Welcome to Healthscopic, where we uncover the truth behind the health headlines that have the world talking. Today, we're diving into Human Metapneumovirus, or HMPV, the so-called mystery virus making waves in China. Is it something new? Is it dangerous? And should you be worried? Let's get into it. What's happening in China? China's hospitals are seeing an alarming influx of respiratory infections, and many of these cases are being linked to HMPV. Social media is buzzing with speculation, with some even comparing it to COVID-19. But here's the first thing you need to know. HMPV is not new. Discovered in 2001, this virus has been quietly circulating for decades. So, why is it making headlines now? Post-COVID life has changed our immune landscape. Years of masking, distancing, and reduced exposure to everyday pathogens have left many of us more susceptible to viruses like HMPV. It's a perfect storm for a virus that thrives in respiratory pathways. Is HMPV the new COVID? Let's address the elephant in the room. Is HMPV the next pandemic? The answer is a clear no. Unlike COVID-19, HMPV is a well-documented virus, and while it can cause significant illness in vulnerable populations, it lacks the rapid transmissibility and mutation rate of COVID-19 virus. HMPV primarily targets children, the elderly, and immunocompromised individuals. Its symptoms include fever, cough, nasal congestion, and fatigue. Severe cases can lead to bronchitis or pneumonia, but the majority of infections are mild and self-limiting. Do we have vaccines or treatments? Unfortunately, there's no specific vaccine or antiviral medication for HMPV yet. Treatment is supportive. Think hydration, rest, and symptom relief. For severe cases, hospitalization may be required. But here's some hope. Ongoing research into vaccines and treatments could make HMPV far less of a threat in the future. It's a race against time, and scientists are determined to get ahead of this virus. How bad can it get? For most people, HMPV feels like a bad cold or mild flu. But for vulnerable groups, it can escalate into serious respiratory complications. The good news? The mortality rate remains low, and proper medical care significantly reduces risks. The key takeaway is vigilance, not panic. So, what can you do? Prevention is your best defense. Here's how you can stay ahead of HMPV. Wash your hands thoroughly and frequently. Avoid close contact with sick individuals. Disinfect high-touch surfaces regularly. And if you're unwell, mask up to protect those around you. Small actions can make a big difference. How scared should you be? So, should you be scared? Let's not mince words. No. While the media thrives on sensationalism, the reality is that HMPV is manageable. Awareness and prevention are your best allies, not fear. Think of HMPV as a reminder, not a threat. It reminds us to prioritize hygiene, stay informed, and never underestimate the power of good health practices. The bigger picture. HMPV might not be the next COVID-19, but it's a wake-up call. Our immune systems, altered by years of pandemic life, are encountering viruses differently. The world of infectious diseases is evolving, and staying informed is your strongest weapon. If you learned something today, hit that like button, subscribe, and click on the bell icon for more no-nonsense health breakdowns. And tell us in the comments, what's your biggest question about viruses like HMPV? We're here to give you the facts, not the fear.